How to lose your weight. This is one of the most requested inquiries, or you can say doubts, from my patients and relatives as well. You're going to hear two important options that you can choose into your weight loss program. Welcome to DSR Studio. Option number 1. If weight loss is not your priority, but it's important, then the first option is for you. This is a general approach you can follow. First is check your weight, height, and calculate your BMI according to that. You can calculate BMI in the BMI calculator on the internet. You can find it. Then from there, calculate your target weight, the weight you want to achieve from your BMI. You can use your BMI to know that target BMI, target weight. Once you know your target weight, the most important thing you have to do is inform this weight, the target weight, to your closed members. It can be your friends, relatives, or your family members. They will keep you accountable for doing this. If you're not motivated, if your motivation is not to the threshold level, imagine yourself what they'll think of you if you don't achieve your goal. That will make you proceed. Once you disseminate this information to the closed ones, next comes the implementation. Portion control. It means decreasing the quantity of the food in all the parameters. You need not decrease one kind of food, but you need to decrease all the kinds you're eating. Along with that, perform some physical exercise and calculate your calories if you can. How much calories you are consuming, how much you are expending. You can keep a book for this if you want. Next, weekly weight measurements. Check your weight weekly, once in a week. Optimum level of weight loss per week is half kg, not more than that. Remember that. This is the first approach. The second approach, if you are fitness freak, or if your weight loss is important and a priority, highest priority for you, for your career, then this tech approach is for you. Install calorie counter and diet tracker app into your phone. Once you install it, feed the information into this. It will ask your weight, it will ask your height, your BMI, your activity level, sex, and then it will calculate the calorie budget, like how much calories you have to take. That will be equal to how many calories you will be spending. It will match. For example, if you are feeding the food, like food calories, the amount of calories you eat into the app, it will match the calorie budget that according to your data with these food levels, food calories, and it will instruct you how many calories to be consumed per day. Make sure, an important point here, before you do this, here also you can disseminate information, spread this information to your closed ones, and then do it. You may also need to feed the target weight into this, remember that. It will be calculated based upon the BMI calculator, you can find it. The main important thing here is your calorie intake should be less and the calorie expenditure should be high, like it should be increased. Weekly measurements of your weight should be taken. It should be not more than half kilogram per week. The weight loss should not be more than half kg per week. Remember this point, this is an important point for optimum results. Okay, once you have reached your target weight, what next? To keep this weight maintained, you have to decrease the intake of calories and increase the expenditure of the calories. You have to maintain that. One important point to note here is if your weight is not if you're not able to reach your weight, or if you have some other comorbidities like thyroid problem, diabetes, you need to consult the doctor first so that he or she can evaluate all these factors into account and can suggest pharmacotherapy appropriately. This video is a part of social initiatives of Shanvika Hospital, Medchal, Telangana. Thanks for watching.